Hi, it's me, Shirley Gutkowski. I'm a dental hygienist, and I'm speaking to you today from my home office. We started a conversation a little bit ago about your first visit, and I was kind of telling you what happened to my father, who was a little bit surprised by the 4-hour new patient appointment that he had at a dental office. It was a very large group practice with multiple locations. And what happened for him, I believe, is that someone canceled an appointment right after his, and they had time open to fill. And I'm not saying that's a bad thing. Sometimes it's a really great thing, and you can get a bunch of things done that you maybe knew you needed, but you didn't have time to do in the future, or you needed to get it done before your insurance benefits ran out, or I don't know. There's a bunch of reasons to do it, but if you don't exactly know what's going on, it's not exactly fun. And you may develop a bad attitude towards your dental practice, and that's not something that you want to do. So, when you go for your new patient appointment, hopefully they will have taken a full mouth series of x-rays, which I already talked about, and they would have done a periodontal evaluation to detect whether or not you have periodontal disease, which is good. And they may have then a treatment plan, kind of a section of the appointment. A new patient appointment can last about an hour or so. If you know it's going to last an hour or so, that's not bad. So it would be a good idea to ask on the phone how long the appointment is for. Often, if there is an opening in the schedule after your original appointment is completed, they will present you with some kind of a treatment plan of the recommendations that they felt you should have, or the treatments that you should have. And then they will say, we have an hour right now. If you'd like to, we can start right now. And if you are a little confused, or if you don't really understand what they're saying in the first place, which is different from confusion, don't ask me how, then you may say, okay, go ahead, and then you're going to be stuck with a huge bill that you are not prepared for. So I would encourage you to make a plan before you go. If you are available to do the treatment afterwards, really get an estimate of how much the treatment is going to be and how much longer it's going to take. My mother sat in the reception room not knowing what was going on for the entire time. And if you are a dental health care provider and you're watching me telling my patients this, or your patients this, I would encourage you to make sure that doesn't happen, because now there are two confused people, two unhappy people, and two people looking at a giant dental bill that they were not prepared to pay for. So there you go. That is the short version of a new patient exam in a dental clinic. I hope to hear from you if you have any stories to share, or if you'd like any help with anything. I do dental hygiene consulting, and you can find me just about anywhere on the internet. My name is Shirley Gutkowski, Gutkowski. Talk to you soon.